I'm Dr. Ed Weaver with Wilmington Optometry in Wilmington, North Carolina, on behalf of Expert Village to tell you how to care for your contact lenses. Some of the consequences of not caring for your contact lenses properly, first of all, I'd say the first category would be not keeping your hands clean and touching your contacts and your eye with unclean hands. This is probably the number one problem with contact lens wearers, is not maintaining good hygiene. This almost always leads to eye infections, either on the short term or the long term, but eventually a person that does not wash their hands before inserting or removing their contacts is going to eventually have an eye infection. Another common mistake with contact lenses that can lead to problems is wearing your contacts too long. If you've got a 2-week lens, you need to get rid of them in 2 weeks. If you've got a 1-day contact lens, you need to get rid of them daily. And if you've got a 1-month lens, you need to get rid of them every month. Now, the reason for this is not to sell more contacts. The reason for this is they're dirty in 2 weeks. A 2-week lens in 14 days is dirty. Believe me, the surface has got deposits, it's got debris, it's got mucus, and those deposits attract bacteria. And the longer you wear that bacteria-laden lens, the more likely you are to have an eye infection. And if you happen to scratch your cornea or you get a foreign body in the eye and scratch the cornea and you're wearing a dirty lens, a bacteria-laden lens, guess what? You're going to have an eye infection. So that's what you want to avoid. The last category would be wearing the lenses that are in an unapproved manner, such as sleeping with contact lenses that are overnight that are not approved for overnight wear. That's probably one of the worst things that you can do because it stresses the cornea and you're likely to have a corneal ulcer, which is a serious focal infection of the eye that can be sight-threatening.